Welcome to another Arizona Oral Health Coalition webinar. This is Framing for Fluoride. In this presentation, we will go over communication techniques for discussing fluoride with policymakers and patients, or anyone else you might have conversations with about fluoride or other health equity topics. I'm Taryn Wallstad. I am the Arizona Oral Health Coalition Advocacy Lead. My background is in dental hygiene, and I've worked in public health and private practice dental settings. I've also worked in non-dental public health at the local government level, and I've been an advocate for oral health with the coalition for 6 years. I am passionate about supporting public policies that make oral health the easiest choice for everyone. I'm very excited to be talking about this topic today because we are all advocates for oral health, either by advocating for policies or advocating for our patients. I would like to thank Autumn Butler, Marissa Farron, Sheba Jones, and Tamara Baca for their input on this presentation. All of these hygienists shared their experiences about what they see in practice, and I really appreciate the variety of perspectives that I heard from them. I've incorporated what they've shared with me into this presentation so that it can be more useful for you all as well. So as advocates, we want to communicate the truth, that fluoride is a safe and effective way to prevent tooth decay. Lately, if someone is hearing about fluoride in the news or on social media, they're likely hearing negative things. Bans, restrictions, and the misinformation or just bad science that is justifying those changes. This is going to lead a lot of people to be unsure about fluoride, so it's a crucial time right now to talk with folks about fluoride as a public health measure. Communication techniques help us connect with people and share our message. As advocates, our ultimate goal for communication is not just to build knowledge, but to inspire action that will benefit individuals and communities. And as I get started, I will say this is an extremely rich topic. It was really hard to narrow down this presentation to fit into 1 hour, and there are so many important pieces that I cannot explore fully. At several points, I will refer you to other resources so that you can look more into it yourself. My goal in this presentation is to give the overview, point you in the right direction, and then share resources that will support you. So when I was creating this presentation, I had 2 main goals in mind. First was to share the frameworks and CareQuest framing guides because they're fabulous, and we're going to get into those later. And I wanted to come at this topic from a different angle than I normally hear, and that's from the emotional side of things. So it's easy to assume that people have anti-fluoride beliefs because they're uninformed or misinformed, but knowledge is actually only part of the equation when it comes to decision making. Emotions drive a large part of accepting new information or making decisions. People are driven by their values, their fears, their habits, their relationships, and that's not a bad thing. Emotions are really the foundation of rational thinking, not the opposite of it. Emotions are always under the surface, driving our decisions based on what is important to us. That's just being human. So when we take the time to understand where people are coming from and what their emotions are saying, we do a better job of sharing information and empowering people to make choices about fluoride. To illustrate this, I would like to tell you all a story about something that I experienced back in 2024. So the dental field is always innovating, and in 2024, there was a major update to one of the most foundational pieces of dental care, which is radiography or x-rays. So the American Dental Association, the Food and Drug Administration, and the American Academy of Oral and Maxillofacial Radiology published new x-ray safety recommendations. After years of research and meta-analysis, they found that lead shielding is no longer necessary during your basic dental x-rays. This includes for children and for pregnant patients. So the research found that modern x-ray machines are safer than they ever have been in history. Compared to your daily sources of radiation like sunlight, a set of dental x-rays once or twice a year is not a substantial risk. In fact, the lead shields actually create a mild risk because they can get in the way of the beam, which would require taking another x-ray. So because of this, the new recommendations state that you don't need the lead apron anymore. So I was in a webinar when they were first announcing this change, and what do you think the reaction was in the chat of this webinar? I mean, what reaction are you feeling right now? I'll be honest and share that when I was first hearing this, I was a bit surprised. It was really different from what I had learned, but I thought about it and I knew that modern x-rays, they are relatively low for radiation exposure. So I was picking up what they were putting down by the end of it. But what I saw in this webinar in the chat from all the other attendees was a lot of pushback. Like literally right to the presenter's face, people just saying like, well, I'm not going to follow these guidelines. And I was shocked. It felt like very dismissive, and I just didn't know, like, were these providers not following evidence-based practice? Did they not trust the science? So after my initial shock, I thought about it more, and over the next few days, I came to realize that a lot of this disagreement was coming from a place of really deep care and concern for patients, and that emotion was so powerful that it was driving dental professionals to ignore this new expert research. And I thought, wow, that feeling must be the exact same thing that someone feels when they ignore expert research about fluoride. So I share all this to say that people need more than the facts. Everyone will have their own blend of emotions that drive their decisions. As dental professionals and advocates, if we can understand and respect the feelings our audience is feeling, we can have conversations that are productive and sensitive to the unique perspectives of each individual. Now, that doesn't mean agreeing with or approving of these decisions, just an understanding. I know I just talked about how everyone has personal, unique experiences, and that is still true, but I am going to talk about some general patterns about fluoride hesitation that can help us prepare for addressing that hesitation. There's not a ton of research out there about fluoride hesitation, but a recent study explored the causes of topical fluoride hesitation among caregivers and separated those reasons into 5 domains. And someone may have concerns about fluoride from one of these domains or several. Anecdotally, I hear these reasons as well from folks who are concerned about community water fluoridation. And as I go through these, please reflect and think, what emotions are you seeing underlying these concerns? So the first domain is the feeling that topical fluoride is unnecessary. The belief that brushing your teeth, having a healthy diet, and making dental visits make topical fluoride unnecessary. As I was talking with people to develop this presentation, this came up a lot. And I think it's true that most people just don't realize that they've been benefiting from fluoride their whole life. A lot of people don't want fluoride varnish for relatively low stakes reasons, and I think that fits into this idea that fluoride isn't necessary. I've heard people don't want to have fluoride because it's fuzzy on their teeth, or because the insurance doesn't cover the $20 fee, or they thought it was just for kids. So that's all feeding into the idea that it's just not necessary. The second domain is a feeling that topical fluoride is a chemical and should be kept out of the body. So this includes ideas that fluoride is not natural, or that it builds up in the body, or that people are already getting too much fluoride and so they don't want another source of fluoride. The third domain is feeling that topical fluoride is harmful. So this includes ideas that topical fluoride leads to autism or lower IQ or learning problems in general. The fourth domain is a feeling that there's too much uncertainty about topical fluoride. This includes ideas that people just don't know about the long-term damage, if there is any. There's also confusion because some research shows that fluoride is harmful and some doctors oppose fluoride. Also, if someone has family or friends that are opposing fluoride, that's just going to lead to uncertainty. And finally, the fifth domain is a feeling of being pressured by dentists and distrusting their motives. This includes feelings about not being told the whole truth about topical fluoride, or dentists just doing it to make money. So as you were hearing about these, I'm assuming some of the emotions that came up might have been things like fear, confusion, but also some more positive emotions like love for your children if you are worried about their safety, or wanting to protect your own safety. And so these emotions, when combined with the lack of knowledge about the necessity of fluoride and about the safety of fluoride, that is what leads to the hesitation. A parent who loves their child will do anything to protect them. So when they see a Facebook reel saying misinformation about fluoride, they're really going to consider if fluoride is the way to go. And that's why it's so important to ask folks about the root of their hesitation. And depending on that reason for hesitation, our response can acknowledge that reason and then help them make more informed decisions about fluoride. I do want to talk for a moment about conspiracy theory. So not every fluoride hesitant or fluoride refusing person is a conspiracy theorist. However, the emerging research about conspiracy theory is not only really fascinating, but it is useful to our discussion about the emotions behind decisions. I personally believe that the emotions that cause some people to fall into conspiracy theories are still applicable to the non-conspiracy theory hesitant folks. For starters, research shows that conspiracy thinking is deeply rooted in emotions. Even though a lot of people will use data to justify a conspiracy theory, oftentimes new data that conflicts with that theory is not by itself strong enough to change minds. People are more likely to believe conspiracy theories when they lack power or control. Literally, negative emotional experiences of lacking power affects the brain and increases the likelihood that people will think that events, even random ones, are connected and are someone's fault. Conspiracy theory is believed to be protective by removing discomfort when things are uncertain, conflicting, random, or just unpleasant. Right now, we know there is a lot of conflicting information about fluoride coming from social media, the federal government, and dental professionals. And so the certainty provided by a conspiracy theory might be preferable. Conspiracy theory can actually crop up anywhere, anytime that there are tensions between competing groups, even something as low stakes as sports. But it's ultimately rooted in an us versus them mentality. So the us group is a group with a shared identity or experience, and then the them is a group with power over other groups that's perceived as hostile, such as leaders, someone with power, maybe politicians or managers. And often this group is a group that is already disliked and is easy to cast as this sort of nefarious group. So, is there an us versus them mentality with dental professionals? I would say yes. Dental professionals have a pretty uphill battle when it comes to public opinion. I am a dental provider, I'm a dental hygienist, so I will say I don't, this does not exclude me, but my fellow dental providers, we have to recognize we are the arbiters of pain. We have the power to resolve dental pain, but going to the dentist is not a cozy situation, okay? Let's be honest. There's definitely a power dynamic there. And that power dynamic is influencing how people feel about fluoride. So while the emotional reasons behind fluoride hesitation do present a challenge, it also presents the opportunity to support someone by responding to their emotional and informational needs. So emerging research about conspiracy theory shows that an antidote is empathy and trust building. Supporting positive emotions like hope, security, and power can help reduce belief in conspiracy theories. And promoting agency and choice helps reduce the conflict between groups. While all of this research was focused on conspiracy theory, I do believe that it's applicable to all fluoride hesitation. Addressing the emotional causes allows for a more open conversation about the facts. So as an example of responding to misinformation, you might say something like, hey, thank you for bringing up these concerns. I can see that you're doing your best to keep your kid, your family, your community, or yourself safe and healthy. There's some scary rumors online about fluoride. Can we go over some information together so that you can decide if you want the varnish today? Something like this is validating the emotions and giving agency to empower that decision. And for these informational needs, there's a ton of resources out there. I highly recommend using resources from the American Dental Association and ilikemyteeth.org. When you're sharing this information, if you're talking to a patient, you'll want to highlight their personal risk and how fluoride can protect their health. That means this will vary from person to person. Giving general or vague explanations misses an opportunity for someone to genuinely make a decision. If you're talking to a policymaker, there's some great talking points guides. These provide language to respond to misinformation and to discuss the community-wide protective factors or barriers and what policies can promote oral health, such as community water fluoridation. Again, you'll want to be specific, or someone might assume that fluoride isn't needed. There is one major thing I want to point out. When debunking, do not repeat the misinformation. Don't do it. People are more likely to remember the things the more they hear it, and they won't remember the part where you said it's not true. So share only the true information. Okay, so we've talked about the foundations of fluoride hesitation. Now we're going to get into some specific strategies for framing how we talk about fluoride. So what is framing? Framing is choices about how to present information to shape how people think about the information and how they react to it. This includes decisions about emphasis, verbiage, connections, your tone. Basically, we're thinking about not just what you say, but also how you say it. Framing helps us meet the audience where they're at. As we've been talking about, everyone has varying beliefs, attitudes, and values, so different messages and terminology will resonate. So, have you seen headlines like this lately? Reflect. How do you feel reading these headlines? I'm assuming you're feeling things maybe like stress, fear, concern, anger. This is because these headlines are using what's called crisis framing. So this framing technique includes using shocking words to create those strong emotions. It's intended to be a wake-up call to startle someone into action. However, the actual impact tends to be a feeling of being overwhelmed, tuning out the information. Over time, if someone is hearing a lot of crisis framing and hearing about all these bad things, but the world still turns and the world still goes on, over time that leads to a loss of trust or just dismissing information out of hand. Obviously, we don't want these things to happen. We want people to tune in and trust and take action, but we still need to talk about the problems. So that's why we want to use different framing strategies. Framing is helpful for meeting the audience where they're at. But where is our audience in general? Of course, specific audiences will vary, but we do see overall patterns that we can default to without that further information. These are widely held beliefs about health. The first is individualism. So this is the belief that health is a result of personal choices and motivation. In this mindset, the primary strategy to improve health is to provide education so that individuals can have the information to change their behavior. However, this mindset generally does not recognize systemic or neighborhood factors. An example of this is the advice to eat right and brush your teeth as the way to be healthy. But this is ignoring if a neighborhood has a grocery store with nutritious food, or if someone has access to toothpaste. The second is fatalism. So despite this morbid name, fatalism just means the belief that there is little control over health outcomes. So in this mindset, someone may believe that there's no reason to try because the outcome is unavoidable. An example of fatalism is when someone says, "Oh, everyone in my family lost their teeth, so it's going to happen to me too." This is a refrain a little too familiar to every dental professional. And these two beliefs influence how people conceptualize health disparities. Individualism leads people to believe that individual behaviors or personally mediated discrimination is the cause of a health disparity. There is little to no recognition for the social causes, such as laws or policies. And then fatalism leads to the belief that disparities are unfortunate but not unjust, because they're just naturally occurring differences that can't be avoided. So the framing strategies that we'll look at today will help overcome these deeply entrenched and unproductive assumptions. There are many great frames out there, and there is no single best frame. It really depends on the info you're communicating. The frames on the following slides are a synthesis of recommendations from the Frameworks Institute, the CareQuest Institute, CDC, NACCHO. Many of these framing recommendations from all these organizations overlap, so I'm just sharing these high-level patterns. I highly recommend looking at the resources more closely for specific examples and details. The frames that I've chosen to include here are also particularly relevant for inspiring action for fluoride. Frameworks Institute in particular is one of the leading organizations creating framing recommendations. Their resources, especially the Framing for Oral Health Equity Now document, which was created in collaboration with CareQuest last year, is a really fabulous resource that includes more deep dives about frames, lots of template testimony, some grab and go quick messages, and information about prioritizing audiences. This presentation that I'm doing right now is no replacement for reading them if you're really in the biz of changing mindsets about oral health policy. So there are 7 frames in the Frameworks and CareQuest Institute Framing for Oral Health Equity Now toolkit. I'm not going to go over all 7 of them individually, so again, totally check out this document. It is really helpful. The first frame that we will go over is the connection between oral health and overall health. So using this frame means being clear about the two-way connection between oral health and overall health. And we do this because the average person does not know this. Using this frame will broaden the scope of the problem so that people understand that it's more than just oral health, it's all health. And that also will broaden potential policy solutions and encourage creativity. This frame is really helpful for both providers and advocates. It'll look a little different depending on the situation you're using it in, but you really just can't go wrong with this frame. To use this frame, it's pretty simple. You'll just want to connect oral health issues to other health conditions, including chronic disease and behavioral and mental health issues. You can also connect oral health to overall community and social wellness. Another strategy is to avoid language or imagery that limits the focus to teeth. So using words like healthy smiles or using a lot of isolated tooth imagery can pull people away from this frame. Some examples of this frame saying oral health is a key component of overall health and well-being. Pretty straightforward. You could also say something like, the community is at higher risk of cavities without water fluoridation, putting overall health at risk. The next frame is to focus on solutions. This means including potential strategies when discussing issues and not only the problem itself. We do this because it really helps to avoid the fatalism, the overwhelm, and the compassion fatigue, especially that we see with crisis framing. Including solutions helps to emphasize the downside of doing nothing and emphasizes the benefits of taking action. By the way, emphasizing the downsides of inaction really tends to resonate more with conservative audiences. Again, this frame works well for providers and advocates, but it will look a little different depending on the situation. So to focus on solutions, you can use actionable terms when describing solutions and emphasize collective solutions like policies and programs. Something like, we can change the system, is not an actionable or tangible example, so please avoid language like that when using a solution frame. When talking about policy, do be intentional to avoid focusing on individual approaches, such as education, because that will lead to the assumption that people are at fault for their health problems, sort of dipping into that individualism mindset. To focus on solution, you can show the audience what solutions and successes look like at different levels so they believe that change is possible. One great way to do this is to describe the current strategies that you or your organization is doing. And you could also use examples from similar states or jurisdictions. CareQuest Institute actually has some really great resources for this. They have a map tool that you could see what other states are doing. They post a lot of blog posts with success stories from other states. So if you're looking for examples, definitely check out CareQuest Institute. For providers, when you're talking about solutions, this includes sharing what fluoride options are good for someone based on their risk. Also, folks who distrust the science are more likely to trust personal experience, so sharing your experience with fluoride can help build confidence in fluoride. Some examples of a solution frame include teledentistry, mobile clinics, and school-based programs remove transportation barriers to oral health. So we're not just talking about the barriers, we're talking about some strategies. And also, the city can adjust fluoride to the optimum level in drinking water to reduce tooth decay. Great example of a solution. I have a quick tip about plain language. So plain language is describing a topic without vocabulary terms, jargon, or buzzwords. It also includes giving specific examples and telling illustrative stories to explain a concept. So an example of a not plain language phrase is cultural humility, accessibility, and strategies to address social determinants of health are all ways to promote oral health equity. This is a true statement. I'm not saying it's incorrect, but it's full of vocabulary that someone might not understand, especially if they're not really familiar with oral health equity. Instead, we can use plain language and examples to really explain what we mean. So we could say, when it comes to oral health, everyone has different needs. Some people need public transportation to get to dental offices. Some people need a dental office with language interpretation. Meeting these needs helps everyone reach good oral health. I admit it is a little wordier, but it is so much more tangible and approachable. All right, our next frame is connecting to values. This frame highlights how disparities threaten deeply held values and how solving the causes of disparities reinforces our shared values. This frame is effective because it resonates and motivates when talking about the causes of disparities and proposing solutions. Recent research from CareQuest and Frameworks found that the value of dignity and human dignity helps to avoid partisanship or hyper-individualism. This frame is helpful for providers and advocates. For providers, you'll specifically want to focus on key values that your patient has shared. To use this frame, you can connect to some general values that include things like innovation, ingenuity, liberty, democracy, safety, security. These are kind of general popular values and honestly kind of sound like something you'd hear in a commercial for a pickup truck, but if it works, it works. In the toolkit, Frameworks does delve into ideal times to use specific values and gives a much deeper dive into various values, so I definitely recommend checking that out. A particular value that might be helpful around fluoride is to frame fluoride in terms of natural processes. You might say something about how fluoride is a mineral that is strengthening your body's natural tooth structure. Some other examples of connecting to values include saying that we have innovative solutions that work. Community water fluoridation is a cost-effective solution that protects the entire community. Really leaning on that innovation. And talking about a solution too, 2 for 1. You could also say we're a community of problem solvers. That's so inspiring. All right, one more quick tip. So we often use data as advocates, but data does not speak for itself. We can frame our data to make sure that we're getting our message across. To frame your data, you'll want to lead with your message and then bring in a statistic or two to back it up. Remember, less is more. Focus on a few key stats that best explain the problem and avoid throwing a whole bunch of statistics at someone and overwhelming them. We don't want someone to get overwhelmed and get into that fatalism. We can see in this box here, there is a lot of data. I'm not going to read it all. And saying all this, it's just going to overwhelm someone. And we're not actually clear about what we want them to do with this information. Instead, let's frame it using a data sandwich. So we start with our message. Establish a strong message, preferably a frame. Then you could select one or a few statistics that are especially important. Remember, less is more. One tip is to choose data that is highlighting systems to avoid that individualism. Then explain your data. Remember, it does not speak for itself. You could take a moment to unpack the data point to avoid misinterpretations or unproductive mindsets. And then wrap it all up by restating your message to further reinforce it. So my example here is about fluoride. So instead of throwing all those statistics, I might say, we have innovative solutions that work. Community water fluoridation is a cost-effective solution that protects the entire community. Fluoride in the water reduces the rate of new tooth decay by 25 to 30% by being another layer of protection in addition to brushing and visiting the dentist. By protecting water fluoridation, we can create a healthier, more prosperous Arizona. So I'm very clear about why I'm sharing this data and what I want someone to do with it, while also avoiding those unproductive mindsets. And then my final frame is interconnectedness or shared fate. This frame emphasizes the collective impact of disparities so people see that they too are impacted, either directly or indirectly. This frame is especially helpful because it helps us combat the entrenched individualism that often leads to zero-sum thinking and an us versus them mindset. This frame leverages empathy, and honestly, it leverages self-interest as well. I hear some pushback sometimes about this frame, which is understandable. This frame is not implying that everyone is equally harmed by disparities. Equity still does mean dedicating additional resources to overcome gaps and provide support to groups most affected. We as advocates know this, but sometimes people who are not as familiar really need to hear what's in it for them. Remember, our goal is to inspire action. So to do this, you can explain that actions taken to ensure equity for one group of people does not take away from the health or resources of any other group. In fact, it can actually lead to benefits for everyone. This is sometimes called the curb cut effect. To talk about shared fate, you can use gain frame and loss framed messaging to highlight the connection between individual health and community health. So gained frame messaging, you could say when everyone in the community has access to oral health, that makes for a more prosperous community. So really talking about the benefits. You could also use loss frame messaging to talk about the downsides of what happens when there are barriers to health in the community. This can include talking about loss of productivity, or ERs being overburdened, classrooms losing students, and healthcare costs rise. That will get attention. All right, those are the key frames that I have to share. Please, again, I really recommend checking out those resources from Frameworks, CareQuest, CDC, NACCHO. They're all really fabulous, and I will share them. Keep an eye out for the Coalition's Fluoride webpage, which will be coming soon. And as we finish up this presentation, I really encourage you to reflect on which framing strategies you'll be able to use in your role. If something stood out to you as something that you already talk about, or maybe it's something that you hear a lot, take a deeper look and see how you can start implementing it in your role.